Right? It is only one sperm which will be penetrating the ova. There itself you are won the battle. Right? So you have won the battle. Okay? So you yourself are like unique. So it is like you are going to a war without a sword with you. Right? वो याद रखने के लिए बहुत तकलीफ होते थे मेरे को. Hormonal fluctuations will be there in the entire process of the life. But this is the age where the fluctuations are in the peak. Right?
Yes, sir.
So we need to hold on our consciousness. Right? Pre-excitation syndromes like WPW syndrome.
Yes, sir.
So the impulse to the ventricle is occurring prematurely. And ventricle is going into a state of arrhythmia and the patient will die. Okay? So similarly, the relations whatever are happening, that should not happen prematurely. It should happen appropriately. And at the same time, it should not be late as well.
Yes,
right?
sir.
There will be apoptosis. Right?
Hello everyone, I am Dr. Rishabh and today I have the privilege to interview Dr. Rajesh Gubba, Faculty of Medicine at Next Tilo. Dr. Rajesh has made a significant contribution in advancement of general medicine. Let's have a word with him. Thank you, sir, for joining us today here in our podcast. And could you please introduce yourself to our audience?
Right. First of all, thank you very much, Dr. Rishabh, for having me.
Thank you, sir.
So, I am myself Dr. Rajesh Gubba. I am the general medicine educator and I am also the practicing cardiologist. So, this is my brief introduction.
So, sir, I have a list of questions which students from all over the globe has sent me. So, these are just the questions which students have doubts in subject while studying medicine. So, I'll go through the list of questions which I received. So, students want to ask you in generally how to approach medicine while studying.
Right. So, general medicine is like one of the voluminous subject among all the 19 subjects that you will be preparing for either your NEET PG exam or INA CET exam or the FMGE exam. Now, why it has become so voluminous is because it is the integration of all the basic subjects. So, general medicine is like nothing but it is integration of your physiology, pathology, pharmacology and parts of the microbiology. Because it is integration of all these subjects, that is the reason why it is very much voluminous. So how to approach is that you need to be very much strong in these particular basic subjects. Once you are very strong in these basic subjects, then reading and understanding of general medicine just becomes a cakewalk for you. So the approach should be from your basic subjects.
Your basics. That's what my second question is, like how medicine should be started. It should be started prior to the preclinical subjects, or you have to study the preclinical subjects.
Right. So if you take starting of the general medicine, it has to be started when you are in the second MBBS itself. Like for example, you take in the Indian scenario medical colleges, you get the postings of general medicine in the second year itself. You'll be posted to the general medicine wards in the second year itself. So in the second year of your general medicine, you need not start directly with the chapters of general medicine. But what is that you need to start in your second year of MBBS is that you need to start how to approach the patient. So the basic history taking is very, very important in your second year of MBBS.
So you mean, sir, that you need not to start medicine directly. You need to start it in a sense from physiology. You can correlate the physiology aspect to medicine and not directly to jump directly studying medicine. You can start from the second year itself while correlating it.
Yes.
With other
So
subjects.
never jump onto general medicine directly because general medicine is one particular subject which is you have a lot of clinicals. So it becomes very tempting for the student directly to jump onto the general medicine, open the book and start the preparation, which is not correct. So first you need to start your physiology, as I have said you, thoroughly understand the concepts in the physiology. Then you read path pharma of that particular topic. Like for example, you take, let us just assume cardiology. You take cardiovascular system, you read it thoroughly in physio. Then you understand the cardiovascular pathology from pathology point of view.
Yes, sir.
And then you read pharmacology of that particular cardiology topic. After reading these three, cardiology, physio, cardiology, pharma, cardiology, patho, now you read general medicine cardiology chapter, then you will really feel the essence of that particular clinical subject.
Yes.
So that is the best way of the approaching the general medicine.
Yes, sir. So, sir, these were the few questions about general medicine. Now, I will ask you some questions related to the exam. Like exam in general, any exam, rather be FMGE or NEET PG. Like how to prioritize subjects for such competitive exam. How to prioritize different subjects, these 19 subjects.
Right. So, see, The prioritization in the recent times, like you should be, it's completely based on what is the weightage of that particular subject in your exams. So if you take the clinical subjects, like they have a very good weightage. For example, you take general medicine, it has a weightage of nearly around 30 to 40 marks. Either you take in your NEET PG or INI CET or even your FMGE exam also. And you take the surgery, you take PSM, you take gynec. These are all the high weightage subjects. So I don't tell that you should read completely only these subjects, but if you ask me like which subject has to be prioritized without leaving for the preparation means, then these subjects should be must in your preparation, like medicine, surgery, gynec, then PSM, which is very, very important. So these are like clinical subjects, and even ophthalm and ENT. Okay. When you take like non-clinical or paraclinical, very important is your path pharma, micro, and at biochem. So these are like major weightage subjects. So you have to go to your exam like thoroughly prepared with these particular subjects.
Okay. And so my next question is like, how crucial is the time management during the exam? Like time management during the preparation and time management during the exam itself.
Yeah, see, like many of the students, they have this time crunch while attempting the exam. Now, why do you get this particular time crunch is because you did not give proper exams or proper grand tests during your preparation. See, during your preparation, only theory preparation is not just enough for your exams. Along with theory, you should also give as many number of exams as well as grand tests. That will help you in your time management in your final exam. So if you are just going to the exam like before giving like any grand test, you are just going to final exam without giving any particular exams during your preparation. So it is like you are going to a war without a sword with you. Right?
Yes,
so
sir.
like you have to go like completely prepared.
Yes, sir.
Right?
Yes,
So
sir.
like the complete preparation in the sense like theoretical preparation and as well as the exam preparation as well. So you have to give as many number of exams as possible during your preparation time.
So you mean that reading notes only is not going to help you?
Yes,
So
yes.
you need to give the grand test, you need to solve so many MCQs, and
Yes.
you need to clinically correlate these
Yes,
subjects.
yes,
Okay.
yes, yes.
And so my next question is how important it is to stay updated with the recent updates and advancement in the guidelines in the medicine.
Yeah. See, regarding the general medicine or you take any clinical subjects, when we use the term update, the update is mainly related to the treatment aspect. Okay? Because see, you don't get any update related to clinical features, right? You don't get much update related to the pathophysiology. Everything has been done, studied depth until now. If at all, if any update comes, like the update comes in the treatment, the update comes in the new investigation. So you need to be like updated with what are the new guidelines in the treatment, what are the new diagnostic protocols which have been introduced is what you need to learn if any update is there. That is very, very important because like the examiner will try to ask you the questions from the recent updates. So you need to be definitely updated regarding if there is any change in the treatment guidelines of a particular disease.
So to focus mainly on the treatment.
Yes,
and
yes.
in the new changes which
Yes,
has
yes,
been made.
yes,
Okay, sir.
yes.
So, sir, can you highlight the common pitfalls which students usually make while preparing for the exam?
Yeah. So this is very, very important question. All the students have to listen to this. The common pitfalls like what the student faces and because of which he will not be able to clear the exam is, as I was just telling you just before, giving adequate number of exams. See, many of the students will just read the theory of particular topic and just be satisfied that, okay, we are done with this topic. That's the biggest mistake. So after reading a topic, you have to do multiple choice questions of that particular topic also. Then only you will understand how the questions can be asked from that theory what you have read. So not doing multiple choice questions or not giving adequate number of exams or not giving adequate number of grand tests is one of the very, very important pitfall. Second important pitfall is like the revisions. Many of the students will think that doing revision is equivalent to time waste. Okay, but you have to ensure that whatever the topic which has been read on the prior day, the next day you have to keep at least 1 or 2 hours to revise the previous day topics, right? And by the end of the week, like you have to summarize yourself. What are the difficult things that I have read in this week? Let me just make out extra time on that particular difficult things. So adequate number of revisions, identifying the difficult area, what you feel in your entire preparation is very, very important. So if you don't give adequate revisions, then again it's a very biggest pitfall. And the next important is the lack of confidence in you. See, what happens is many of the times we start comparing our marks with our colleagues. We start comparing our answering in the class with others. If we get less marks than compared to our friends, if we are not able to answer in the class compared to our friends, we feel ourselves low, right? And that makes you a state of negative mentality and will not progress you in your preparation. So what I suggest you is, please don't compare yourself with anyone. You just be yourself as a unique person, right? So see, already you have won the battle like when you are born. See, for example, if you take the ova in the mother, right? Millions of sperms will be going to the ova.
Yes, sir.
Right? It is only one sperm which will be penetrating the ova. There itself you have won the battle, right? So you have won the battle, okay? So you yourself are like unique.
Yes,
so
sir.
just be confident on yourself and then progress your preparation.
Yes,
so these
sir.
are the common pitfalls many of the students they do face, and because of which the preparation does not go very smoothly.
So in my personal experience, when the exam date was coming near, I was very anxious and I thought that I might not pass. So I didn't knew that how to control this anxiety. Do you have any like trick to how to manage this anxiety issues and sleep issues?
Yes. So this is another very, very important problem many of the students face. As the exam is approaching, the anxiety level builds up. This is like a universal phenomena. Okay, even the topper who will be the topper in that particular exam, you just go and ask him like, how is your preparation? He says, अरे ठीक नहीं हुआ यार, और थोड़ा ढंग से पढ़ना था, नहीं किया है. So everyone will have this in their mind. Okay, but as I have said you, first and foremost, you have to believe in yourself. The self-confidence is very, very important, right? And next is, if you have given adequate number of revisions, then the level of anxiety it is less. So during your preparation itself, your revisions should be a very good number of revisions. Minimum by the time you go to the exam, you have to give almost 4 to 5 revisions of the entire 19 subjects. Then you will feel confident in yourself. The level of the anxiety will be slightly less.
Okay, sir.
Okay. So what I mean to say basically is revisions. Revisions are very, very important.
So when I was preparing for the exam, I was like gaining weight and anxiety. So I want to ask you that how important is exercise, yoga and meditation during the exam?
Right, yes. For your preparation of the exam, 2 important things which are required is, one is your mental peace and second is your physical stability. These 2 are very important for your preparation. If you are not mentally peace, you cannot prepare properly. If you are physically unstable, then you cannot prepare properly. Now, in order to achieve that mental peace, right, the maneuvers, or I say like the things that we can do is, like one is yoga and then meditation. Mainly like aerobic exercises. You know, aerobic exercises, they improve the oxygenation and they improve the cerebral perfusion. And that will give you the sense of the happiness. And mainly if you take exercise, there is a lot of endorphins which are being released. I'm telling you, you just practice this. One day you do your preparation with adequate amount of exercise. You get up in the morning, do 30 minutes of brisk exercises and then go ahead with your preparation. That should be your one day. The other day, without any exercise, like as a routine thing, like what you do, you just do your preparation. You yourself will make out a lot of difference. Whenever we do this exercise, the happy hormones, that is endorphins are being released. So that will give you a sense of happiness and a push to go ahead with your preparation. So this exercise, yoga, meditation, they are very much required during our preparation. But usually most of the times what do we feel is, we feel like we are wasting much of our time in this, right? So the half an hour, whatever we are spending on this yoga meditation, we want to revise something or we want to read something. But you have to understand that the half an hour that you are spending on your exercise, yoga, meditation, that will give your productivity almost 2 times. That is very, very important.
Sir, talking of mental peace, I have a special question. This is, I'll tell you an incident. There was a friend of mine who used to study a lot. He used to study like 15 to 16 hours a day. Who used to give all the grand tests. He used to score 200 plus, but he failed in the exam, and the reason was relationship issues. He recently had a breakup before the exam, and he was not feeling peaceful. So this is a special question, and some of you might also be facing this issue. So how to manage this situation, sir?
Right. So I definitely have to answer this properly and thoroughly, because this is another universal problem, I say, right? So, right, see, like this is the age, like 20 to 30 years of age is that particular age group. Like two things, right? If you work hard, you will be able to build up your career properly. And if you are like deviated during the same age, like you will be completely destroying your entire career. So you can build the career, you can destroy the career also during this particular age group, okay? And a lot of hormonal fluctuations also are in the peak during this particular age group. Hormonal fluctuations will be there in the entire process of the life, but this is the age where the fluctuations are in the peak, right?
Yes, sir. Yes,
so we need to hold on the consciousness, right?
Yes,
we need to be like mentally stable on this particular relations issue.
Yes,
See,
sir.
everything has to occur at appropriate time,
Yes, sir.
right? It should not be like premature. Like, see, for example, you take in cardiology, like we have pre-excitation syndromes like
Yes, sir.
WPW syndrome.
Yes, sir.
So the impulse to the ventricle is occurring prematurely. When ventricle is going
Yes,
into a
sir.
state of arrhythmia and the patient will die. Okay. So similarly, the relations whatever like are happening, that should not happen prematurely. It should happen appropriately. And at the same time, it should not be late as well,
Yes,
right?
sir.
There will be apoptosis, right? So you need to be very careful when to start the relations,
Yes,
right?
sir.
So majority of the students, like this is a very key issue. You need to hold on your mental consciousness very stable during this particular age group. So you put your extreme efforts during this particular age group, like you can achieve whatever you want in the next later part of your life. So be like mentally very strong and don't go beyond this particular relations now itself at this particular age group, right? And don't take the rare examples. Mera ek senior tha, right? So he was along with a girl, uska shadi hua hai, right? They are settled very nicely now. That happens very rarely, right? So out of 100 it will be like one. Remaining 99 will be like breakups
That's
only.
true.
Okay, so like just take care of your career very strongly at this moment of time and progress properly.
So we should prioritize our career over relationship.
yes,
That's
yes.
how we can manage this.
Right,
So,
right.
so my last question is about your personal inspiration. How you like? What was your inspiration to become a doctor and a teacher and a great teacher actually?
Yeah. Okay. So like see, to become the doctor was like I did not have the personal dream of becoming doctor. It was like imprinted or incorporated by my father. So my father used to do a lot of social activities where there was requirement of doctor in the rural places, right? And where he used to call the doctors and for the social activity. So once he thought like I'm calling doctors for this social activity and all. So what he thought was like, why don't I make my son itself a doctor so that like he will be of use for me for all my social activities. That was his instinct, which he like incorporated into me, and that made me to just go into this doctor. Okay. Now becoming the teacher, yes, this was my passion. See, once I've joined my first MBBS, like during this anatomy dissections, like over the stretcher, I used to teach a particular topic or a particular organ to my colleagues. ताकि like anatomy जैसा subject है, it is very much volatile.
Yes, sir. Yes, sir.
आप ज़्यादा revise करोगे, then it will be like imprinted into your brain.
Yes, sir.
Like for example, you take urinary bladder, right? उसका 19-20 ligaments है. So वो याद रखने के लिए बहुत तकलीफ होते थे मेरे को. So then what I used to do is I used to call my colleagues. Then I used to teach all these ligaments. Then that used to become like a cakewalk for me.
Yes.
Right? And when I entered into second year, I used to teach my first year juniors. When I entered into third year, I was teaching my first and second year. What was my instinct at that particular time is I teach more, right? It will be like more and more revision for me. It will be easy for me for my post graduation.
Yes, sir. And
that
that's
was my
nice,
instinct.
sir. Yeah.
But whatever I have done during my MBBS career, that made me to become like a good teacher in front of you all
Yes,
now.
sir. Yes, sir. So to summarize everything what sir has said, you need to do more and more revisions. That's right, sir.
Yes.
And
yes.
then you need to solve MCQ, a number of MCQs. You need to give grand, and you need not to compare yourself with others because everyone is a unique personality.
Yes.
And you need not to compare your scores as well. So you need to focus on your career over your relationship. I thank Dr. Rajesh Gubba for his valuable time and experience. It has been a pleasure learning from his wealth of knowledge and experience. I hope this conversation will be useful to our listeners. Thank you, goodbye, das Svidaniya, until we meet again.